consultants, we have over 10 resident doctors, we have medical physicists, about 10, we have radiation therapists, we have oncology nurses, and we have other administrative staff.
Right.
So it's a well-equipped, it's about the biggest in the, like, West Africa.
Wow, so it's very, very big.
Yeah.
So as I speak right now, anybody that's listening to us right now and has been thinking of, okay, where should I go? NSIA can accommodate any patient.
Very well.
All right, so let's now come to the subject of discourse this morning, cervical cancer. So what kind of cancer are we talking about when we say cervical cancer?
Okay, cervical cancer is the cancer of the mouth of the womb in women. So when when you're about to deliver, we measure somewhere how many cm dilated is that place. So that place that is being measured is the cervix. So the cancer that arises from that place is called cervical cancer. So invariably it's only in women, and it's actually the second commonest cancer in women, especially in Sub-Saharan Africa, following breast cancer, which is the commonest cancer worldwide.
Right.
And it's also the second commonest cause of cancer death in women of the middle age, from like 20 to 45.
Right.
Is about the commonest after breast cancer.
So is it a public health concern?
It is, because in developed nations, they're not talking of cervical cancer again, because it's been eradicated to a reasonable extent. There are vaccines to prevent it. It's actually one of the cancers that can be cured if caught early. You know, in quotes, you can say some cancers are good and some are bad. So cervical cancer can be one of the good ones, in the sense that when it can be prevented, and then with pap smear, regular screening, it can be caught very early, and when well treated, it can actually be cured.
Right. So you did say that is the second most common cancer, so to say, in this part of the world, right?
Yeah,
so
in women.
So can we get figures to back that up? So like how many people?
Well, like averagely like about 10 to 12 new cases every year, and death can be up to like 8,000. Yeah, 8,000.
Right?
Yeah, per year, new cases, and the death from it, especially in this area, can also be up to like 8,000 deaths, which is not meant to be. It's quite high.
That's very, very huge. I mean, that means you're telling me about 75% of them that contract disease will die. That's what it means.
Yeah, because most of our patients...
Just hold on 1 second. Let's take this call. Hello there. Good morning.
Good morning.
Amabude, talk to me. What's happening where you are?
What's happening count. I can confirm to you generally nutrition.
Okay. All right. Network really not performing well there, but she seemed to say the area of coverage is looking good. That's around the Ikeja and Okwebi-Allen corridor. Amabude, if you can reconnect, I would appreciate that. So we're saying that 75% of people who contract the disease are likely to die here in Nigeria?
Yeah, because most of our cases, they present late. So we have stages 3B, 4A, 4B, which are even metastasized. So this actually brings it, it increases the morbidity and mortality. So, and then before now, because we don't have access to radiotherapy machine, has been almost next to nothing. Now the figures have changed a bit, but still far from reach. And then the next major factor of treatment in cervical cancer is brachytherapy.
We'll come to that even as the program moves on this morning. But if you put Nigeria side by side with other African countries, are we the one with the burden of highest prevalence?
Well, we have the highest population, so it won't be far-fetched. We still have the highest prevalence.
Wow.
And okay, like I said, like in Zambia, because cervical cancer is actually more of a sexually transmitted disease, and so it goes alongside HPV virus, and it's also common in HIV patients. So some countries still has more incidence of HIV. So in a way, they may have more, but because we also are highly populated, we have quite high.
Good morning, traffic radio.
All right, then let's take that call. Amabude, you're back on the program.
Yeah.
Hello. Go ahead.
The network is bad.
Yeah.
I just to quickly say that we are still having it camp generally.
Okay.
The already was still calm, all around about FOB, salvation, welfare, in and out, Sheraton Beach. I see good to go for now, generally, and no cause for alarm.
Right.
But if anything changes, I'll let you guys know about it.
All right, then. I appreciate that. Thank you so much. Okay, so that's the Okwebi-Allen corridor right here in Ikeja. Still looking very good. She says most of the areas of coverage is very, very good for now. So it will be far-fetched if we say Nigeria carries the highest prevalence burden, right?
Yeah, I won't be far from it.
Okay, so let's look at what could cause cervical cancer. What are the predisposing factors?
Okay, like I said, cervical cancer is more of a sexually transmitted disease. So disease, so you might not even find it in nuns. There are sisters, Catholic sisters. So it shows that, it shows that it's largely linked to the sexual activity. So you find it more in, and a major factor is HPV, that's human papilloma virus infection, which is actually transmitted sexually. So you find it more in people with multiple sexual partners.
So outside sex, nothing else would cause cervical cancer. Is that what you're saying?
It's a major, like over 95% of the cause is sexually transmitted.
What else can cause it?
So other factors are actually negligible. So such that, well, because I've seen one or two cases, like I said, I've seen one or two cases when the sexual history is not so significant and they still come into it, but they are quite negligible. So such that if you practice safe sex and regular screening, you can almost be certain that you might not be a victim.
Okay. So sex.
So like I said, multiple sexual partner, then partners with multiple sexual partners. So so if you are at home, you are doing your thing with only one partner, but the partner is playing so many away games, so the person is likely going to get infection and come and give it to you in the confines of your home. And then so women should have had that multi-gravida, they've had plenty children, so you know that they've had more exposure to sexual intercourse, so more exposure to the sexually transmitted diseases. Then it's also found in HIV is also associated. So most of it is actually associated with sexual.
Right. Okay, so are there myths? Are there some myths that have been carried about this particular disease?
Yeah, myths and misconception generally with cancer is there. So by the time an average, most of us on this side of the divide believes that cancer is generally an attack, an arrow, otter, and stuff like that. So because when you see the presentation of cervical cancer, you see a postmenopausal woman, like in her 70s, she has stopped menstruating, she just started bleeding, because that's the major one. So the first thing you want to think about is that this must be an attack. So generally, instead of them to find out, so by the time people are having post-menstruation, postmenopausal bleeding, vaginal bleeding, and some people, when they are having sexual intercourse, even with their partner, they are having bleeding in between. Then some people, they have irregular menstrual bleeding. So maybe after you have finished your cycle.
No, these are signs, right?
These are some of the signs.
Which is supposed to be my next question. But the myths now, which are saying now that people believe is an offer, it's a missile sent from somewhere.
Yeah.
Those are some of the common myths and misconceptions about it, right?
Yeah.
So dwelling on these signs, major signs, you said bleeding is one?
Yeah, bleeding. All form of abnormal vaginal bleeding.
Okay.
So it can be postmenopausal, somebody that has stopped menstruating. It can be bleeding, having bleeding during sexual intercourse. It can be regular menstrual bleeding.
It cannot. If the person bleeds during the intercourse.
During the intercourse, it is not always.
Okay.
But then it may just be a sign that you just need to check. It might be some infection can cause it, but then, like I said, infection is also strongly linked to cervical cancer. So you might just need to check some more. Then some people, irregular menstrual bleeding in between, after you finish your menstruation, you're actually bleeding. Then some people on examination, contact, somebody just trying to examine you, and bleeding is coming when it's as if you are menstruating. So any form of irregular bleeding. The another major one is a discharge, a foul-smelling, watery discharge.
Okay.
So it might not be bleeding, but this is foul-smelling, is watery, a bit. Some may have it colored, but it's actually foul-smelling, watery discharge.
Okay.
Either from a sexually active person or somebody that has entered menopause. It's also a sign of cervical cancer. Might be a sign.
All right. So these are signs. These are some of the symptoms that people should take note of from time to time in women. All right. So what age category will cervical cancer affect in women? I mean, what age category does it present?
Okay, so like I said, it's strongly linked to sexual intercourse. So it's actually commoner in the middle age group. So some people may come, and especially those that have the infection, they may even come in earlier. So people in their late 20s, 30s to like 45, 50, they are the common age group we have. But then at times we have some quite elderly people. At least I've seen a patient that is about, I think the mama is almost 90 or 100 coming down with cervical cancer.
90?
Yeah. So we have a wide elderly, but they are not common. So it's usually in the middle age.
So what would you think would have happened for a 90-year-old woman?
Well, most of those, at that age, they have multiple sexual partners or partners with multiple sexual partners.
For a woman of that, I thought women from 70s.
No.
Really,
Cancer still comes
really engage in sexual activity.
The ones they've had, the seed had been sown, so it actually manifested
over the years.
And
it stays there.
Yeah.
Okay. All right. These are some lessons this morning that we're getting. All right. So cervical cancer, you talk about the signs, the symptoms, the age. Do we have younger people presenting with it as well?
Yes, we have seen some, but most times they might be associated with the HIV. Those that have HIV infection, they might come in earlier.
All right.
So you might come in their late 20s.
All right. So is cervical cancer, is it curable?
Yeah, it's quite curable. So I'll even start from the fact that it is highly preventable.
It's preventable.
Yeah. So at least Lagos State had rolled out, federal government had rolled out a human papilloma virus vaccine.
Right.
Yes, for children
from age 9.
From age 9 to like 14 or more. And the essence is that those that are not yet sexually exposed. So some people in their 20s, if they are not sexually exposed, they should still take it. So it actually prevents the human papilloma virus infection. And if that is taken care of, at least over 90% of the cause of cervical cancer is taken care of. Then pap smear is a means of screening for this infection. So people do that, we'll be able to catch it early. Some of them may just need only surgery, and some even not so intense surgery, and then that will cure it. And then some that are coming at stage 1, even stage 2, stage 3, they can still be cured. So it's actually curable if treated early and rightly.
So how are the stages determined? Because you just mentioned now that a lot of people present very, very late. So how are those stages? When you say stage 1, stage 2?
Okay, so we stage cancer based on different parameters. The tumor size, if there are lymph node involvement, and if it has spread from its primary places. So this is grouped like that. So I'll just say generally stages 1 and 2 are when it is early. Most times it's still limited to where it's starting from. When it's getting to stage 3, it has spread to lymph nodes that drains that region, and it has even spread to some of the organs around it. Like in the cervix, there's bladder, there's rectum that are very close to it. When it's getting to those places, it's getting to like stage 3B or 4. And then stage 4B, it is when it has spread to distant organ. So a patient that is having cervical cancer, by the time it's getting to the liver, it's getting to the lungs, it's getting to the bone, in some cases maybe to the brain, it has actually spread. So it's actually an advanced disease.
All right. Lagos Traffic Radio, you've heard at 6.1 FM. This morning, we're doing cervical cancer awareness, juggling the facts, figures, and misconceptions. And taking us to the classroom this morning, Dr. Bolanle Adegboyega, consultant, clinical and radiation oncologist, and also head of the Brachytherapy department of NSIA-LUTH Cancer Center. We'll talk about that and what brachytherapy does in the treatment of cervical cancer. But let's get back to the roads right now. You can also share your own experience with us with your travel needs right now. Most of the areas that you've navigated through, you can let us know. Lagos Abeokuta Expressway, I understand it's still looking good at the moment. No major worries driving through that end. K2 this morning, slow movement from Iyano School inwards Ilele, Ikosi Junction. This is due to pedestrian crossing and, of course, early morning rush at Ikosi Junction as well. We can tell you Ikosi inwards Fruit Market down to the interchange, linking you up with Ojota proper, looking pretty good to go. Fruit Market connecting you with Toll Gate is also very good to go. And then the return journey from Ojota inwards interchange, Tipa Garage, Demori Junction, Ilele, and Iyano School inwards Kushofe to mile 12, very much in good shape, and traffic managers on ground trying to ensure that you have it good navigating through that corridor this morning. Taking you to the other side of town, CBD Marina End is steady movement along Inner Marina, proceeding towards Outer Marina from UBA Roundabout, NNPC Filling Station, and Kakawai Junction, proceeding towards Cathedral intersection, all looking pretty good. But slow while descending from CMS Bridge to the bus stop there. Further movement towards Nightel Junction and State House is also looking good. We can tell you if you're connecting Flagstaff House as well as Independence Bridge from Zone 2 Bridge, and of course the Balinde Bridge, heading towards Victoria Island and the 3rd Mainland Bridge, all looking very, very good this morning. Return journey from TBS, of course, and of course Waterboy to General Hospital and other adjoining streets within the axis looking very, very good too. All right, then, so you might want to also add your voice to the conversation this morning. If you want to ask any question from our guest, feel free to link up with us on 08099120777. That's 08099120777 and 091-5387-7127. Those are the numbers that you can use to connect with us on the program this morning. I have Dr. Bolanle Adegboyega with us this morning. All right, so you said it's curable, right?
Yeah.
And there are signs. Do you have testimonies to show that in Nigeria as well?
We have quite a number. Like I said, before we had brachytherapy, we cannot beat our chest and say we have achieved a cure. But in this case, when we have brachytherapy alongside brachytherapy,
Let's take this call. Hello there. Good morning.
Hello. Good morning.
All right.
Traffic radio.
Yeah. What's your name?
Hello. Good morning.
Good morning.
Traffic radio. Good morning.
Yeah. Good morning. What's your name? What is your name?
Good morning.
Yeah, we can hear you. Go ahead. It looks like a bad connection. Let's see if we can just take that off and right. All right, then 08099120777. Okay. Yeah. Hello there.
Hello, good morning.
Yeah. Good morning.
My name is Barbara.
Barbara, go ahead.
I'm calling from Marina.
Yeah, go ahead, Barbara.
Yes, Sigma, you were saying from ages 9 to 14, our children could take the vaccine.
Right.
Please, where exactly can they go?
To collect the vaccine, right?
Yes, please.
Okay.
well, I know the vaccines were taken to schools and there's some religious houses. So I think at this stage you can actually get to in the nearest local government to you, health centers,
Primary health care center.
primary health care center, and you'll be rightly directed. Yeah.
Oh, my issue now, my children are in boarding school.
Okay.
So I don't know, is it when they come on holidays that they can take it?
Yeah, when they come on holiday
Yes,
or
when they do
winter
that.
break, yeah.
Barbara,
How many dosage, please?
how many what?
1, 2.
How many doses?
Yes, I mean, how many of the injection are they supposed to take?
It's a one-off. The one that was done by Lagos State government was a one-off.
Okay.
Right. Okay, but just listen on your radio. Maybe I can just explain to you much better.
Thank you so much.
All right, thank you. So that was in November, the October, November.
yeah.
So the state government carried out a vaccination exercise for all children from 9 to 14 on the HPV. So if you missed out on that, you can visit the primary health care center for more. Hello there. Good morning. Hello. Okay, I think that's a bad connection as well. 08099120777. I'm expecting that I should have more women call on the program today because it's a disease that affects more women, right?
For women.
Yeah. So they should be able to express themselves much better this morning. Hello there, good morning.
Good morning. My name is Clement.
Clement, where are you calling from?
I want to ask, the NSIA Cancer Center, is it a reference center or somebody can just walk in?
Yeah, it's both. You can get a referral letter and you can also walk in. The essence of referral letter is for us to know what has been done for you wherever you are coming from so that we can continue without repeating or going back and forth. So there is both.
All right, thank you.
You're welcome.
All right, Clement, thank you so much. I'm sure that people will still want to ask a lot of more questions about this center as well. But anybody can get there. Is that any time of the week that you can come to the NSIA?
Yeah, we work Monday to Friday, 8 to 5.
Okay.
Then we have contact numbers and we have a website that you can visit for more information. Even pre-book your your visits.
Oh, good.
Yeah.
So you have that as well.
Yeah.
Okay. All right, then 0809-912-0777. That's the number that you can call.
Hello.
Hello there. Hello.
Good morning.
Yeah, good morning. Who am I speaking with?
Daniel.
Daniel. Did you say Daniel? Okay, so that looks like a young person was playing with his mom's phone or something. But he should be in school if that's the case. All right. So you say it's curable, right?
Yeah.
Let's talk about brachytherapy, because that's the first time I'm hearing about that. What kind of technology or innovation is that? Well, let's take this call. Let's take this call first. Hello there.
Good morning, Mr. Victor.
Good morning. Who am I speaking with?
Mrs. Lawal on the line.
Hey, Mrs. Lawal. How are you doing?
Fine, thank you.
Great.
Thank you for this enlightenment again.
Right.
For the benefit of the caller who was asking where she can get the vaccine, I want to say that it is now an integrated immunization with our routine immunization for all the children. So you can walk into any health center, whether secondary, primary, or tertiary, and they will be immunized. She doesn't have to wait until they come on holidays. We're no longer going to schools because the campaign is over.
Okay.
It's integrated now.
Good.
In all facilities.
Good.
Thank
good.
you.
Thank you. Thank you for that information. We do appreciate you. All right. So, Barbara, so now you heard it. You can walk into any of the health centers right here in Lagos. Like she says, it has been integrated into the immunization program right here in Lagos. So just take your children there and they will be well vaccinated against cervical cancer. All right. Madam, you're a specialist in this area, right? So
Yep.
talk to me about brachytherapy.
Okay, so radiotherapy generally is when you use radiation to treat cancer. And so it's been broadly divided into two. One is when you treat from a distance, and that is what we call teletherapy. That's the one that is quite common. And it's as if you are just in a CT scan machine, you are lying down and the radiation is coming from a distance.
Okay.
So brachytherapy is a short distance therapy. So in this case, we are bringing the radiation therapy into nearer or almost inside the cancer itself.
Isn't it dangerous?
So yeah, the essence is that you are able to give a high dose to the cancer and you spare surrounding structures as much as possible.
Oh.
You know, when you are treating from a distance, there are so many other normal structures in your field. So that way you only give it to a particular dose. So you do use that one to cone down and give higher dose such that you are curing the cancer and you are sparing the surrounding structures.
So this one is much more effective.
Yeah, it's the combination. We use both of them. So like I said, before we have the therapy.
All right. Let's take this call. Hello there.
Good morning.
Good morning. Yeah, good morning.
Good morning, our guests in the house.
Thank
Good
you.
morning, ma.
Good morning.
Welcome, ma. Please, I just want to know this HPV vaccine. I normally hear that part on radio, saying children the age 5 and 9. But Madam just said today that any lady, any girl about that age that is not sexually active can also go for the vaccine. What about the lady of 19 going to 20 that has not experienced that? Can she go for the vaccine too?
Yes, even those that are more than that, if they are still virgins, they have not been sexually exposed, they can do it. So the campaign Lagos State is giving is because we don't have as much supply. So that's why they targeted that age group. And you want to believe that that age group, they should not still be sexually exposed. So, but for others, so in case you're not even getting it from the Lagos State, you may have to pay out of pocket and then get it.
What's your name, sir?
My name is Shegun Adebiyi.
Adebiyi. All right. You're calling from where?
From Kechi.
Okay, too. All right, then. Thank you so much, Shegun Adebiyi.
Thank you.
Okay, so any lady can go for the test. But for those who are already beyond that, maybe they are already married, and what kind of test would they go for?
Okay, so when somebody is already married, I believe that person is sexually active. So in that case, they go for pap smear.
Okay.
So that one will check the cervix itself, and then they will do that regularly, maybe once in 3 years, and some other things. Then there's other tests like HPV. They can also do that as a blood test to check if they have the infection or not.
Let's take this call. Hello there.
Hello, good morning.
Good morning.
Yeah, this is Comrade Daniel.
Nice to hear from you, Comrade Daniel.
Hello?
Yeah, good morning.
Hello, can you hear me?
Yeah, we can hear you, Comrade Daniel. Go ahead.
I can't hear you, Victor. I don't know if you're hearing.
Yeah, I can hear you, but go ahead. Okay, it's a bad connection. We'll try and see how we clean that up. 08099120777. All right, so but for the center, is it accessible? Where is it located?
It's inside Lagos University Teaching Hospital. Like I said, it's a PPP between Lagos University Teaching Hospital and the Nigerian Sovereign Investment Authority.
Okay.
So it's still inside LUTH, Idiaraba, Lagos University Teaching Hospital, Idiaraba, Mushin,
Okay.
Lagos.
Okay, so I'm sure people will be asking that question now of how affordable are this kind of centers? Well, let's take this call. Hello there.
Yeah, good morning, Victor. I can hear you now.
Okay, Comrade Daniel.
Yes, good morning, Victor.
Good morning.
Yes, I greet your guest to the studio this morning.
Good morning,
madam.
thank you.
Yeah, what is the difference between chemotherapy and the one you just chemotherapy?
Brachytherapy.
Okay. Chemotherapy
Yes.
we are using. Okay.
Yeah, just run over your question so she can answer you at once.
All right, thank you.
All right.
Okay, so chemotherapy, we are using drugs to treat this cancer. And chemotherapy, because it's drug, anything you take into your body works around the whole body. So it's a systemic kind of treatment. Whereas brachytherapy or radiation therapy is we are using radiation, and in that case, it is focused to where we want to treat. So it's not a systemic. If you want to treat the breast, you only treat that area, and the other surrounding structure is different.
Right.
Then in cervical cancer, we actually use a combination of both chemotherapy and radiation therapy,
So
depending on the stage.
Yeah, so
and
brachy is new,
brachytherapy
right?
too. Brachy is not new, only that the type we have in NSIA-LUTH Cancer Center is actually the first of its kind, or rather we are the only one that has that in Nigeria functional.
As we speak right now.
As we speak, we have other, we call something 2D, but our own is 3D, so it's image guided.
Wow.
We are not only putting those instruments, we are seeing it on the computer, and then knowing which dose is getting to which structure, and at the same time we'll be able to calculate the dose they have had from the other form of radiation therapy to know what is safe for this particular one.
Let's take this call. Hello there, good morning.
Hello, good morning. This is Falaka calling from Ikeja.
Falaka from Ikeja. Let's hear from you quickly.
Yes. Well, I have a question. I want to ask somebody that has been exposed to cells, can he take the vaccine? And if the person parabench all knowing that's the question.
No, what is the question?
And somebody that my question is that somebody that has been exposed to sex
Yes.
now go ahead to take the vaccine.
Right.
So yes, that's what I want to know, whether
There's any kind of effect.
or yeah.
Okay, all right. Just listen on your radio.
Okay, so thank you for that. So somebody that has been exposed to somebody that has been sexually active
Right.
may not, why we are saying they should not have it is that because before you have it, you are actually supposed to do a test, HPV test, to see whether you have the infection or not.
Okay.
So that's because we don't go that route. That's why we say that, okay, we have been sexually exposed, don't bother. So let's know that it's actually for people to prevent them. So for those that have had the sexually exposed and they have taken the vaccine, I believe there is no effect. But in that case, if you have the infection, it might not treat the infection, and the infection might still lead to cancer.
So let's put it this way.
At that rate, you may still need to go for your pap smear
So let's put it this way. So you're married, you have children, you're sexually active, but you go for the pap smear, and it shows that you are not positive, so to say, that you do not have the is it HPV now?
The HPV, yes, yes.
So can you still go ahead and take the vaccine?
So in that case, I believe it's a possibility, but at the same time, it's not as if you are not going to continue having sex. So in that case, HPV, the vaccine might not be the ideal for you. It's a regular screening. Because the fact that you do a screening this time around and you don't have the infection does not mean that 2-3 years down the line, the infection might not be there, especially if the person is not with one partner.
Right.
So, and we don't want people to go with the notion that I've been vaccinated, I can live my life anyhow, thinking you have been vaccinated.
All right.
It doesn't work like that.
Let's begin to take this up this morning. Where is, you said it's located inside LUTH, right?
Yes.
And you said you have some contacts that people can reach, or your website? How can people reach you guys?
Yeah, so I will try and pull up the center number. We can reach us on the phone number. NLCC number is
okay. Let's say why you
0903
okay
000
right
9436. I'll take it again. 090 3000 9436.
Okay.
The second number 090 3000 9438.
Oh, okay.
So any of those numbers you can actually call and then for further information.
All right, Dr. Bolanle Adegboyega, nice having you in the building. I wish this conversation can continue from time to time, but we're so grateful that you would take us through this excursion on a successful delight this morning. Thank you so much for being here.
Thank you for having me.
Okay. All right, she's been here and she's taken us to the classroom this morning on juggling with the facts, figures, and misconceptions of cervical cancer. And if you're wondering who she is, she's a consultant, clinical and radiation oncologist, and she's also the head of the Brachytherapy unit of the NSIA-LUTH Cancer Center. So we have to go. The program this morning has been produced by Mike James. Big thanks to him as well. I must say big thank you to Honora Moloku, who is a cancer advocate working tirelessly for this program to come on stream. Halima Ogundeji in the building. Not forgetting our social media team. Our executive producer is Tayo Akonle. My name is Victor Oteri. Have a great day. I'm out. Stay very much within. Bye.
Mixture.